Uh, I'm Raza Fazel, an assistant professor of medicine in the Division of Cardiology at the Emory University School of Medicine. Well, use of medical imaging has been rising at a pretty rapid rate over the past decade, and a lot of these imaging procedures use ionizing radiation and expose patients to radiation. So there's been increasing interest in this topic and concern about radiation exposure in patients. Just this last March, the National Council on Radiation Protection published a paper, and they found that basically they reported the average exposure of individuals in the U.S. to radiation from medical imaging procedures. We, in our study, looked at the same issue, and our findings were consistent with theirs, but there were also the novel findings of our study were, one, we also looked not just at the average in the overall population, but at the exposure within demographic subgroups by age and gender. Second, we also looked at specific rates of low, moderate, and high rates of exposure in the population rather than just the average again. And finally, we also looked at specific procedures to get a sense of which procedures are contributing the most to the overall radiation exposure. The millisievert is a unit for this this measure of the effective dose, and basically what that is meant to do is reflect the harmful effects of a given radiation exposure in terms of the biological effect. To put it in perspective, a chest X-ray, for instance, a simple chest X-ray is about 2/100ths of a millisievert. To add sort of further perspective to this, we're all exposed to radiation from radioactive elements in the soil and in the earth, and from cosmic rays from space. So there's background radiation that we're all exposed to. In the U.S., that is estimated to be about 3 millisieverts per year. So that gives you a sense of what kind of numbers we're talking about with these studies. And that's, those are pretty low doses. The occupational limits for radiation exposure among healthcare workers and nuclear industry workers is 100 millisieverts over a 5-year period, so an average of 20 millisieverts per year, with a stipulation that there should not be more than 50 millisieverts within any given year. So we used claims data, billing data from United Healthcare in 5 different regions in the U.S., looking at almost 1 million patients over a 3-year period, and we focused on non-elderly adults defined as patients aged 18 through 65 years of age, and used the claims data to determine what procedures were done in this population, and then used published values from the literature to estimate the effective dose of those procedures, and that allowed us to calculate the exposure rates in the population. Well, in the study we used those occupational cutoffs as sort of our markers, and if you look at doses more than 20 millisieverts per year, if you extrapolate our findings to the general U.S. population, over 4 million people get 20 millisieverts or more every year. So one sort of caveat there is that we're looking at an insured population, and extrapolating that data to the non-insured, to the elderly, is questionable. That's a great point. Well, the current sort of prevailing thought regarding the risk of exposures to these level of doses is that, and it's a view endorsed by the Institute of Medicine, is that there's really no lower limit for these risks. Any any radiation is potentially harmful, and the higher the dose, the greater the potential effect. Now, the data, as you mentioned, is based on epidemiologic data from survivors, Hiroshima survivors, and information from registries among health workers in the nuclear industry. And the data for this link between radiation and cancer risk for doses above 50 millisieverts is fairly conclusive. For doses lower than that, the evidence is a bit more circumstantial. Sure. Well, in terms of, in general, which types of imaging modalities contributed the most, CT scans and myocardial perfusion scans were basically accounted for the bare portion of radiation exposure, about 3/4 of all the radiation exposure. And looking at specific procedures, the most, basically the top procedure in terms of contribution to radiation exposure was myocardial perfusion imaging, or the cardiac nuclear stress test, which accounted for about 1/5 of all the radiation exposure. Following that was CT of the abdomen, then pelvis, and then chest. So those were among the procedures contributing the most radiation. There's been a few studies looking at that issue specifically, and the results indicate that there's a gap there, that many physicians are not fully aware of the specifics of this issue. For instance, what doses each procedures are associated with, and sort of the specific risk associated with these kinds of doses. And there have been increasing efforts to raise physician awareness and patient awareness. For instance, the Image Gently campaign focuses on more pediatric imaging, but and the American College of Radiology has some initiatives. So there is an ongoing effort to raise awareness about this issue among both physicians and patients and healthcare workers. A few of the institutions, the American Heart Association just released a statement regarding this issue, and they're interested in this issue. The American College of Radiology is one of the leading institutions looking at this, and the Image Gently campaign is associated with the American College of Radiology, and those are a few of the examples of institutions involved in this. And so one key thing I want to mention is, we'd like to emphasize that the goal of this study is not to scare people and have them refuse needed procedures. The individual risk from any of these procedures in terms of cancer risk is very small. So if the patient has an indication for the procedure and they're going to benefit from it, that really outweighs the risk of any potential risk from a radiation standpoint, which is very small and may or may not occur in the future. It's really those cases where the imaging, the indication for the imaging is not clear or questionable, where this becomes more of an issue. And we have to be aware that these tests have cost not only in terms of dollars but also in terms of radiation risk. So where in those situations where the indication is questionable, this radiation risk should be considered.